Definitely happy to have you. Always a busy time at America's Retirement Headquarters because retirement doesn't really stop. It goes through the holiday season. So while everyone else is running around and, offices may be closed, America's Retirement Headquarters is still for you. So if you have questions about your retirement, even during this time of year, feel free to give a call, 419-794-3030. Also with Medicare and health insurance and things like that, because, Scott, now that AEP has come to an end for yet another year, you can put a bow on the 2022 AEP season. What can people on Medicare expect moving forward into 2023? Those that have chosen their plans already during the annual election period, is that it? Are they locked in, or is that it until next October 15th?
Well, you would think that after the big push for AEP, things would slow down, but we get a little break. And I don't know if the government's giving us a couple of week break here between AEP and OEP, but no, that's a great question, Chris. This past AEP very well may have been my best AEP ever. I was able to help a lot of people, which is very satisfying to me to know that I could actually make a difference in some people's lives. But what's up next is what's called OEP. OEP is the open enrollment period. That runs from January 1st until March 31st. So it's kind of like a do-over, so to speak, or that mulligan for golf, or that do-over. So anybody that signed up for an Advantage plan or a prescription drug plan, a standalone prescription drug plan, you get to make a one-time change moving into 2023. So for example, if you sign up for an Advantage plan, and then you discover sometime from January 1st to March 31st that either the doctor or the hospital is no longer taking that plan, then you get the opportunity to change from that plan and go on to a different plan. You can even go back to the plan you were on prior to making the change during the AEP period. So there are options available during the OEP period, which follows a couple of weeks after AEP closes.
Oh, you mentioned there the little lull between the break, the calm there. If I have to editorialize, I think it's that they don't want to work during the holidays, so that's probably has something to do with it.
Right.
But so you mentioned people with the Advantage plan, they can use this to kind of have that mulligan period. What if someone has a Medigap or a supplement plan? Can they make a change?
Oh, sure. See, so that's a great question also. So I mentioned earlier about the standalone, the PDP plan, right? So the PDP plan is typically what you purchase when you have a Medigap or a Medicare supplement, okay? I will tell you this. If you do have a Medigap or Medicare supplemental policy, the annual and the open enrollment periods do not pertain to those type of plans at all. Okay? So those plans typically follow your birthday month. So most people know, if you don't know, your Medicare birth date month is if you were born, say, February, and let's say February 8th, and your first day of eligibility is the first day of the month you turn 65. So if you purchase a Medigap plan or a Medicare supplement, they're one and the same, so don't be confused by those two. They're one and the same. Then your plan effective dates are February 1st to February 1st that following year. So if you buy a drug plan, in which I always encourage you to purchase a drug plan. If you don't purchase a drug plan when you're first eligible, then you'll incur a lifetime penalty, and we want to avoid penalties. So your prescription plan would run from February 1st until December 31st, and then it would go January to January. So I know that's kind of confusing. So your Medigap or Medicare supplemental policy would run the first day of your 65th birth month, and then your PDP plan would actually run from that month until December 31st and then go on a calendar year.
So again, a lot of different dates and things to keep track of. If you need help with that, you can always give a call to the team, 419-794-3030, or you can reach out to America's Medicare Associates directly, Americasretirementheadquarters.com. That's something we've talked about often on the show is people that are working past, full retirement age, quote unquote, full retirement age, past 65. If someone is already over 65 and they're just now maybe entertaining the possibility of retiring, what kind of options do they have?
So we have a lot of these acronyms, right? We have AEP, we have OEP. Now we're talking about what's called SEP. That's a special enrollment period, okay? Anybody that works past 65 has an employer plan. You stay on that employer plan, and then you all of a sudden you decide to retire. Maybe you're 68 years old. You're going to pull the plug and retire, right? You're going to come in. You're going to meet with the guys here at the America's Retirement Headquarters and get your financial plans put in place, and then you need to worry about Medicare. So during this period, you can actually sign up for Medicare anytime after 65, providing you had a employer plan. One of the things that I'm seeing a lot more, and Chaz, you can even kind of attest to this, but one of the things I see a lot more is people working past 65 to keep those benefits because of maybe some health issues or that, or quite frankly, the cost of inflation, the cost of gas prices, the rising cost of everything, they have to keep working because maybe they're not in a position anymore because of the market fluctuation, things like that. You can sign up anytime after 65, and you actually have 8 months to choose a plan with no penalty. Now, I'm not real sure why you would wait 8 months unless your employer is going to pay, extend your coverage at zero cost. But you can sign up. You have 8 months after you turn 65 and after you retire at 68 or 69, whatever age you decide, to sign up for Medicare with no penalty. So there's a lot of different options available. The special enrollment period, we don't see a whole lot of outside of the OEP or the AEP. Most people are choosing to retire at the end of the year. Maybe a Christmas gift to them is to pull the plug and retire. But, one of the things that I really noticed this past AEP, and it's kind of some shocking numbers to me, was the number of people that just quite frankly didn't know what they hadn't talked to an advisor for probably 10, 15 years, and, just chose, quite frankly, to not do anything. And it was very comforting to me this past AEP to go through and meet with a lot of people. I was able to talk with a lot of those people that didn't really have an advisor, and I was able to, become their advisor and help them out. And, they'll get their annual letters for me to do their reviews. But, it's kind of some staggering numbers out there with people that just don't know what they even have. Mm-hmm. And, you have to know what you have. You have to at least meet with somebody at least once a year to go through some changes. One of the things that I've really instituted this year, kind of setting us apart from a lot of the other advising firms out there, is we do what's called the Get Connected. And I know that Nolan and you, Chaz, right, do the Get Connected, where you bring the client back in and you kind of go through some different things with them. I've instituted that in my business as well, because so often what happens is if you call that 800 number and sign up on from the television advertisements, whatever, once you're enrolled, you really don't talk to anybody anymore, okay? Yeah. And even some advisors do that. They sign you up and maybe you won't hear from them until next AEP. Well, one of the things that we're doing is I will have my clients come back after they get their welcome packet, and we'll sit down with them and we'll actually create their online account so we can navigate through all of their, their plan design, make sure they understand and take advantage of all of the different features, because there's a lot of things that people aren't taking advantage of, like over-the-counter items. Or you can verify doctors and hospitals in the network, and some of the other things is review a claim, and there's so many other things that a lot of people aren't familiar with. So we're doing that now. So for me, yes, AEP is over, but the work doesn't stop because we want these clients to come back in and enroll them in their online accounts and navigate that for them. So. Keep in mind, if you do want to make a change, you still can make a change starting January 1st through the open enrollment period. After that closes, then you're pretty much locked into that plan for the rest of the year.
So again, it's something that we've said numerous times, especially during the annual election period. Make sure that you get this squared away. If you didn't do that prior to December 7th, you've got a little bit more time coming up at the beginning of the year. This is something that just goes to show it is not a, thanks for coming in and we'll see you never sort of relationship with the team at America's Retirement Headquarters and America's Medicare Associates. It's an ongoing relationship, having those annual, if not more frequent reviews, whether it is pertaining to your retirement accounts, whether it's pertaining to your Medicare plan. And there may be situations where you actually don't have to make any changes at all, but it is better to go ahead and have that and find that out than to go to the doctor, say in April, and find out, oh, you really actually should have made these changes, and now you're locked into it. So it's part of the process. It's something that you get squared away. If we threw out a lot of acronyms, I understand that. If you need a little bit of clarification on that, give a call, schedule a time to speak with Scott, 419-794-3030, or you can reach out directly to him. His email address is scottk@theretirementhq.com. You can also find him online, americasmedicareassociates.com.